Hi, I'm Dr. Greg Castello, board certified family practice with CastelloWellness.com and Adventist Health Partners, and we're going to talk today about quitting smoking. There's 4 basic options to quit smoking. The first one is cold turkey. That's kind of tough to do, but you just quit smoking and see how it goes. The second option is to quit smoking and take some type of a nicotine replacement in place of cigarettes, and that could be a patch or a gum or a lozenge or something like this in place of smoking. What we're doing with this is we're actually breaking nicotine addiction into its 2 separate components. So the first component of addiction is the actual brain's addiction to nicotine. When we take a gum or a lozenge or a patch, we still have ample nicotine in our bloodstream, and we're not actually going through nicotine withdrawal as long as we're on these supplements. The thing that we're doing while we're on this is that we're getting used to not smoking. So the oral sensation, the stuff that you had to do with your fingers, the breathing in of the smoke and the sensation it has on your lungs, the smell, the habit of smoking, these are all part of the problem. And when we do a gum or a lozenge, we're getting over this and we're putting off till later the actual nicotine addiction. And that's okay to do it in 2 separate parts. I do not like the patches because it gives you a continuous nicotine blood level through the entire day, and that's not what you do when you smoke. So you have a elevated blood level, and then it goes away with this when you haven't smoked, and then when you have your next cigarette, your blood level goes up. There's no reason for you to take a puff of a cigarette every 5 minutes, every waking hour to have a consistent blood level. So that's artificial. You don't need that much nicotine. The lozenges or the gum are on demand. So if you need 20 pieces of gum a day, you chew 20 pieces of gum. You can taper that and take less frequent pieces of gum, and you're actually getting over the sensation as well as the nicotine as an option, and that's very helpful. When you use the gum or the lozenge, you do want to be careful to chew it slowly. They talk about parking. So you chew on the gum until you get a peppery taste, and then you park it in the corner of your mouth and bring it back down periodically to release the nicotine a little bit slowly so you don't get sick. It comes in a 2 and 4 milligram dose, and if you are smoking less than a pack a day, you probably want to stick with the lower nicotine, 2 milligrams. If you're smoking more than a pack a day, you can go ahead and use the larger 4 milligrams. So this is nicotine as an on-demand by mouth without actually smoking, and that's a reasonable option. That's number 2. Number 3 is a relatively new medication called Chantix, and this is a prescription medication that's very interesting. It actually looks like nicotine to the brain. So you've got nicotine receptors in your brain. When you smoke, that plugs into the receptors, and that stimulates your body to release dopamine, your happy chemical, and that's how you are satisfied when you have a cigarette. When you take this Chantix medication, it actually looks like nicotine. It plugs into the nicotine receptors, and that does 2 things. One is it actually is occupying the receptor, stimulating your brain into thinking that you have nicotine, and it keeps your brain and your body happy. The second interesting thing is that if you actually do have a cigarette, that actual nicotine goes up and it tries to plug into the nicotine receptor, and because the Chantix molecule is sitting in the receptor, occupying it, it actually blocks the nicotine from stimulating your brain, and all of a sudden smoking starts to feel empty because you're smoking, but you're not getting that dopamine release because it's not getting into your brain. So that's interesting. We want to do the medication for about 6 months. It does have significant potential side effects. Crazy dreams are the most common side effects. I think probably half the people I start on the medication stop it because of the vivid or crazy dreams. It can have some initial nausea, so taking a starter pack the first month and titrating up to the full dose is helpful. It's been associated with suicidal thoughts or ideation and other psychiatric abnormalities, and it's not real clear whether it's because of the medication side effect or because it's a side effect of quitting smoking, although they looked at people who actually continued to smoke while taking the Chantix, and they had suicidal thoughts and some had abnormal behavior. So you have to be careful with the medication. If you do get weird thoughts or sleep disturbance, then you definitely should stop the medication. The last option is a prescription medication called Bupropion, otherwise known as Wellbutrin, which is an antidepressant that's been around for quite a while, also known as Zyban, which is the same medication marketed specifically for smoking cessation. What this medication, Wellbutrin or Zyban, does is it actually raises dopamine levels in your brain, and that's how it works as an antidepressant. Some people that are depressed because they have low dopamine levels, so if I raise your dopamine levels, it helps your depression. When you smoke a cigarette, dopamine is the pleasure chemical, so every time you have a cigarette, you raise your dopamine levels in your brain, and that makes you happy. Likewise, when you quit smoking, your dopamine levels drop significantly, and that puts you into a state of depression, and you either feel bad, or you have a cigarette to feel better, or you have ice cream or chocolate as a different way to get dopamine. So dopamine, the pleasure chemical, stimulated by different things like smoking, eating, jumping out of an airplane, sex, pulling a slot machine. These are all dopamine-related events, and this is why they're addictive and why they're pleasurable. So taking a dopamine-raising medication can help substitute for that dopamine that's going to drop when you stop smoking. Because it is an antidepressant, and just like its antidepressive benefits, it takes 4 to 6 weeks to be fully effective to start raising your dopamine levels. It is not a nicotine or nicotine-type product, so you can continue to smoke on the medication. What I usually have people do is smoke, start the medication, and usually in the 2 to 4 week time period, they start to lose interest in cigarettes because their dopamine levels are elevated because of the medication. They have a cigarette, they don't get that same euphoric effect, and they actually will start dropping out cigarettes on their own. And by 6 weeks, if you haven't made a significant attempt to quit smoking, you can go ahead and stop smoking at that time. You can add the nicotine replacements like the gum and the lozenge if you want to, because it is not a nicotine replacement. So 4 options for smoking: quitting cold turkey, probably the hardest, substituting a nicotine replacement in place of cigarettes, either as a gum or lozenge. I don't like the patches because they are continuous nicotine release. I do have a video on e-cigarettes if you want to watch that. That is better than smoking, but it's not a replacement because it's still breathing the nicotine in. It's still oral fixation, so it's not really that different, and it would be difficult to go from an e-cigarette to quitting cold turkey. Chantix, very effective, but a significant number of side effects. A prescription medication, it costs about as much as a pack of cigarettes a day, so if you have to plunk down $150 a month, bear in mind that's about what you're paying for smoking. Lastly, Wellbutrin or Bupropion, which is a generic medication right now. It's about $25 a month, a very good option. You do want to make sure you want to take it for at least 6 months because it takes that long for your brain to become a non-smoker's brain. So if you take it for less than that, your chances of going back to smoking within a year's time are significantly increased. Dr. Greg Castello, thanks.